Hello, this is Scott Nelson from the Austrian Economics Center in Vienna, Austria. And as a part of our ongoing State of the Country video series, which you can see on fmrs.online, as well as plenty of other content, I'm pleased to be joined here today by Stephane Kouassi. Originally from Côte d'Ivoire and now residing in Frankfurt, Germany, I have the pleasure actually of having known Stephane since he was one of the visiting fellows back in the summer of 2015 at the Austrian Economics Center. So he's been generous enough to give us a little bit of his time today to tell us a bit about the situation in a few different countries. He additionally was a visiting scholar at the American Institute of Economic Research, and presently he is an entrepreneur and conducting research on entrepreneurship. So welcome, Stephane.
Thank you very much, Scott. Thank you for having me.
And thank you for joining us. So, Stephane, seeing as how you have quite a diverse background, having come from Côte d'Ivoire, but having also experienced a bit of the lockdown in the United States, and now being in Frankfurt, Germany, I was wondering actually if you could just give a little bit of an overview in your experience. What does the situation look like in these three countries, and if you could compare them just a little bit?
Yes, thank you very much. It was funny because I joined the area in February 2000 this year. So the COVID was not a big thing. We were just thinking it's just a Chinese thing and it will be limited. So this is what all the global leaders promised to their citizens. And then in the mid of March, things get serious. I have a colleague of mine who went to New York in mid-March and discovered how empty New York was and how cheap hotels were in New York. So we are making some jokes like, oh, it's the best time to go to New York because you can have a suite in a five-star hotel for $100 and having breakfast and everything. So you can see how the economy went, let's say, down or profitable for most people. And then things around 20th of March, things gets very serious because now we went into the lockdown and where supermarkets were empty or get crowded for toilet papers and all these things. And then you had New York totally locked down with the National Guard between New Jersey and New York. And we were in Massachusetts, not that far away from New York City. So it was, the situation was different at the area because we had a bigger campus, 400 acres. And so we appreciate things differently because we didn't actually experience the stress of living in New York or seeing people panicking. But the time we went out in Great Barrington and going to the supermarket, and then we were able to see how people were kind of stressed and how people social distancing or how people were very skeptical or very cautious when they saw some cars with the, let's say, the numbers coming from another cities or states, and then you see how people behave very strange against people who are not from the same town or from the same federal states, So this is typically how we experience it, not very panicking. But on my way back to Germany in the beginning of April this year, I have the opportunity to travel with Amtrak, which was, the train was very empty. So I actually had maybe one wagon for me alone. And then travel over New York Penn Station, very empty. and from there taking the train to Newark, which was really empty. So we, in Newark station, only 3 persons jumped out of the train for an airport. So you can see how empty everything was. And in the Lufthansa flight back to Germany, we were the only international flight that day.
Wow. Okay.
Yeah. So, and in the plane, we were around 50 to 60 persons in the Airbus 330. So this shows also how exceptional it was. Also, it was not a very pleasant experience. And then back to Germany, I was expecting at the airport a kind of very wet situation with people wearing some some chemical protection combination and everything. So, and nothing happened. So it was a normal business like every time when you enter a German airport, except the Frankfurt airport was quite empty. I just went through a police control, and then the police officer just gave me a paper that required me to self-quarantine, and what I did also. So I stayed home like 2 weeks, and then after that, with no evident trace of COVID, so I just continued my life, and the daily life is self-quarantine, social distancing. In Frankfurt, people go to the grocery shop. The public transportation is still working. And I think right now the schools are open and people start their life normally. So I just came from the city today and it's life as usual. Yeah, it's life as usual.
So there's a lot of people out on the street. Do you have to wear still the masks on public transport and things like that?
Yes, you have to wear the mask. You have to, in any public places, you have to wear this mask at the grocery shop, in the supermarket. And I think at the end of this week, the restaurant will be open. Mm-hmm. It used to be takeaway, but now at the end of this week, people will eat in the restaurant, inside the restaurant. So that shows how things restarting. So completely in Germany.
Okay.
Compared to Ivory Coast, to Cote d'Ivoire, where actually it was not possible to shut down the economy because it's due to the local habits and how the market also works there. Everything is on a daily basis. We have a very large traditional economy, what people call informal economy, and where people rely on these daily jobs because they are earning money on a daily basis. So it's quite difficult to shut down the economy, but the government, let's say, react quickly, although it was kind of very unprofessional in the very beginning because everyone gets surprised. People believe, like everywhere in the world, that it was just a Chinese thing that won't happen, and then it happened, and then the government decided to install a kind of curfew between 7 p.m. or let's say 9 p.m. Until the morning. This is the only thing. Schools were closed, but the economy continued. I mean, bars and restaurants were shut down, but major economic activities just continue. And that shows also how different economic systems react to that situation. So actually we have around 1,700 cases of COVID and 800 recovery, and 21 person died from COVID in Ivory Coast. So, I mean, since March, and it's actually the reproduction rates is very low. Mm-hmm. Why or how it did happen, we don't know. I mean, we can have some hypotheses, like I just discussed some hours ago with a friend of mine. She is a data scientist, a biologist, and she attracted to my attention that actually maybe one of the reasons why we didn't experience, or we are not experienced a large scale reproduction of the COVID in African countries, or actually precisely in Ivory Coast, compared or against all the models or all the catastrophic scenarios that were developed regarding developing nations, is that I think we already, I mean, Ivory Coast already experienced COVID, or COVID was already there in January, because in January, there was a very large wave of flu, which is actually uncommon in Ivory Coast, and a lot of people were complaining of having flu. And then, I mean, for countries like Ivory Coast, where people are used to have malaria, they just ran back to malaria medicines. And maybe it's one of the reasons, but another scientific explanation will be that people were already used to live with the virus, you know, so that they learn to live when actually the virus reach a certain level. And people are still learning to live with the virus. This may be an explanation about why many African countries don't experience this large scale pandemic at the moment. And maybe also the traditional medicine, which is actually proving some efficiencies, like with a plant like Artemisia, which is actually well discussed actually in the scientific community, and people were used to, on the traditional basis, were used to have or consume this medicine since years, and this may explain why the average population, which is actually poor, had access to this medicine, because it's in every corner, you know, compared to having medicine for big pharma. So the social intelligence is playing a role, and people actually started washing their hands in the very beginning. So the startup community did a good job also. People start developing some hand washing chemicals, or all kind of solution for the grassroots. So I will say that the social intelligence played a very big role, and also the fact that people are used to take their destiny, the destiny in their hands. When you have some failed government, people are already prepared to take their life in their hands and say, okay, if the government is not reacting, we just want to leave, and we'll do whatever it takes, either be social distancing or washing hands, which were very practical measure that the local population already included in their way of thinking, because don't forget that in 2015, actually, major African countries experienced Ebola.
Mhm.
And this mechanism, the social and local mechanism were already in the mind of the people. So when a kind of pandemic like COVID happened, it just, let's say, reactivate the social mechanism of having this kind of large-scale pandemic. So people were prepared mentally based on their experience.
That's a really interesting point. Actually, you bring up about the sort of prior mental preparation, and as well as the social sort of aptitude of the people there in Cote d'Ivoire. To me, it sort of reminds me of the attitude taken, I think, by some of the Asian countries, which have had the experience in previous years of other pandemics like SARS or MERS or H1N1 and that sort of thing. And it almost seems as soon as, this coronavirus strain rolled around over there, it was almost as if it were like a fire drill. They kind of know the routine, and, everyone just sort of buckles down and does what needs to get done. Whereas for us in Europe, for example, where we're living in very risk-averse societies, and we're also not accustomed to large, waves of death and that sort of thing. It seems that we were really caught a lot more by surprise. So it sounds like the population then in Cote d'Ivoire, they're reacting in a very, I guess, calm and composed sort of manner to what's going on. I mean, obviously, the death count and everything is much lower there than it is in Europe. But it sounds like it's just a sort of a routine kind of disease.
Not really, but I mean, so the prior knowledge about Ebola helped a lot, but I will say on a very funny way that people know that if they get sick, they will die because the health system is not prepared for that.
Right.
So when you know that if you get COVID, you will die, not because I'm not saying that COVID is not deadly, but I mean the risk is much more, it's higher for poor people to die because Ivory Coast, I mean before the COVID, we only had like 80 beds for with artificial respiratory staff. Mm-hmm. So for a population of 25 million, so statistically, seeing if someone got COVID, the chance to die are much more higher than in European countries. So people were mentally prepared to do whatever it takes for them not get contaminated by the COVID. So this is actually one of the reasons, because people knew, okay, yeah, if I take the risk to get it, so I will die, yeah, because our health system is not at all prepared for large scale contamination rate.
Fair enough.
So it's like you fearful person don't take risk to go to war or to start a fight. Let's say like this.
Right. And then, when we turn from the response of the people to the government, I mean, you say, for example, that the government in Cote d'Ivoire, they shut down schools and took a few measures like that. But apart from that, they've largely left the economy up and running. Is there anything that, in your perspective, they could be doing better, or anything else they could be doing, or is it basically they've enacted the proper measures to deal with the virus as it is right now?
Actually, unless testing people, I mean, everything the Western government are doing, testing people, mass testing, it's something lots of countries like Ivory Coast cannot afford to do. So I think testing 100,000 of people, it's not realistic. And but I think the government did some good things like postponing for the entire population the bills for electricity or for water until for the next quarter. This is something that I really appreciate also, so that to decrease the burden, the financial burden.
Mhm.
And then they decided to, let's say, to send money, electronic money, so mobile banking money to a selected number of a very poor household. I think the government identified, I don't know how feasible it is, but they mentioned that they will send money to 40 euros to 100,000 households, which are considered as the poorest of the poor in Ivory Coast. But I mean, in the practicality of this, I don't think, because everyone is waiting for this money. Nobody knows who got this money. And I think this is also the talent of this government to giving some statistic about money, some big money that they will be spending, but nobody knows where the money went. So, but actually, people are used to that. So that this is one of the reasons why they are taking the life in their own hands and do whatever they have to do. So it's kind of social responsibility of the citizen actually against the government, which does its best, but it should do much more.
Fair enough. And when we switch from Cote d'Ivoire back to some of your more recent experiences, namely in the United States and Germany, how would you characterize the government responses in those two countries?
Yeah, I think the German government is well known as a kind of poster child of good reaction and very scientific way of taking decision based on not only on data but on practicality of decisions. So there's nothing more to say about this good job. People expect more, but I think it's because we don't know the, the all the variables of this COVID and how it manifests, because the manifestation of COVID is different. It's context dependent, and the way the virus behaves in Austria is different on the way how it behaves in France or Italy or Spain. So, and I think that the response should be global, but much more local, because the variables are different, the social dynamics are different. So, and I think this is something the German government did well. Maybe it's also due to the fact that the German chancellor is a hard scientist and taking decision differently based on evidence, but also based on wisdom. And I think this is one of the reasons why it didn't spread that much in Germany, but also due to the fact that the German health system is strong enough. And but we don't know actually why or how in Germany things got better. We can just develop some hypothesis, but maybe one day we will know. But what we can judge is the reaction of the leaders and the policy makers. And when we switch to the US, things can be different, where maybe in terms of comparison, Germany being a federal state, the same way like the US is, but in the US you have much more very powerful federal states and where the decision making is at local level, as we experience in New Jersey, sending the National Guard to encourage New Yorkers to go to the other way. So, and then you have a lot of different variables in the U.S. The healthcare system, which is I don't know how to qualify it, but I mean the Americans are better placed to qualify the healthcare system, but they have a lot of problems compared to the potential of the US. But also the reaction of the policymakers in the US. I mean, the government, the president, who in the very beginning was not believing about any factuality regarding COVID, and I think this is something that's slowed down the reaction of the government, and I think this is a bad decision, but also a bad decision which was, let's say, channeled by scientists, and but hopefully, I think we'll get better in the US. Yeah.
Right, fair enough. And so by way to conclude, actually, so how have you been affected personally by the crisis, at least in terms of, for example, you'd mentioned to me, you're an entrepreneur and a researcher. Have you been able to still work as you would have normally, or has your entrepreneurial business also been affected by this crisis?
In terms of scholar, I mean, it's changed a lot. So I had lots of conferences at global level that get canceled. So a lot. I was supposed to be in the beginning of June to DC for a conference. It got canceled. Everything got canceled. A major conference at global level get canceled, and some conferences move on online format, but it's quite different. And then not having access to some libraries when things are not digitalized, it's changed a lot for doing research or having access to people to do interviews or a lot of things. But I think this is something we will learn. So to do things remotely, maybe it's a new game changer about how professions will get impacted by the COVID. But definitely it's changed a lot in my life. A lot of conference, a lot of things, and let's see how it will be.
Indeed. Let's see, indeed. Well, Stephane, I'm not going to take up any more of your time. So thank you very much for taking the time to speak to us today about your experiences here and sharing also your knowledge, not only of the United States and Germany, but also of your home Côte d'Ivoire. This is Stephane Kouassi, who is an entrepreneur and a researcher. Thank you very much, Stephane.